Well, don't turn your nose up to Fido or Fluffy's bad breath. That odor might signify a serious health risk, with the potential to damage not only your pet's teeth and gums, but their internal organs as well. So here to talk to us more about that and pet dental health is Dr. Nancy Soares, President of the American Animal Hospital Association. Welcome back to the Pet Show.
Nice to see you.
Yeah, we're so happy to have you here.
Thank you so much.
February's Pet Dental Health Month.
It is.
A lot hear that and they say, oh, discounts, which is a good thing. But there's more to it than just that. So talk to us about that.
Absolutely. There is a lot more to it than that. But pet dental health care and dental disease is the most common disease that we see in dogs and cats. That's pretty amazing. And in the pet population today, if that's the most common problem, I mean, it can also be manifesting other diseases when you're looking in the pet's mouth. But the most amazing fact to me is that nearly 80% of dogs and cats have detectable periodontal disease by the time they're only 2 years of age.
2 years old.
That's staggering.
Yeah, and most people don't think about getting their pet's teeth cleaned until they're 8, 9, 10 years old. They get into that senior range and they think that that's when we need to start worrying about dental disease.
Absolutely, and that's when they smell the problem, because the #1 clinical sign that pet owners come in and talk about is the bad breath that their pet is showing them, and they can smell it. And almost a third of pet owners admit that they don't cuddle with their pet because of their smelly breath.
Oh my gosh.
It's so sad. It's so
sad. It is sad. And it's something too that is not entirely preventable, but definitely we can help it along the way with some simple tips as long as we start when they're young.
Absolutely. Management of this is the key, is managing it from a very, very early age. And prevention is the best medicine in this case. From the time that they're very young, you want to get both your dogs and your cats, you want to get them used to touching their face, touching their ears, being able to put your fingers into their mouth, not only to brush their teeth, but also in the event that they have something in your mouth that you need to pull out of there. But you know, some dogs will swallow a ball, and you need to be able to, you know, manipulate and touch your pet's mouth. So start at an early age, and the American Animal Hospital Association actually has an excellent how to brush your pet's teeth on their Facebook page. So that's a great place to look.
Okay, and you've got actually got a little skull here that we can do a little show and share, or show and tell. So show us here. You know, one of the most rejected recommendations, I would say, by a veterinarian is to tell our clients, you need to learn to brush your pet's teeth. And they all go, yeah, I can barely get my kids to brush their teeth, much less my pet. So
absolutely.
How long do they need to be doing this? And give us a little example of how to.
Well, the gold standard of care is to brush your pet's teeth every day. Well, in our busy lifestyles, most people can't do that. So there's other things that you can do. We can talk about that. But brushing, starting from an early age, you want to find either a toothbrush. There's also something called a finger brush, which fits on the end of your finger. But the area you want to focus on is, you know, the side of the mouth. You want to have your pet be able to lift their gum if you can, or I'm sorry, lift the cheek, and slide the toothbrush right in here. These are the teeth that you want to focus on. The large cheek teeth, the premolars and the molars, right on the side. If that's the only area that you can focus on, that's fine. But you want to brush right along that gum line. If you don't see any dental disease in there, your veterinarian's not going to be able to see that dental disease either. When a veterinarian looks at every tooth, they need to look at that tooth when that patient's anesthetized and when they're under anesthesia to do a complete, thorough exam of the mouth. And the reason for that is over 50% of dental disease is below the gum line. It's what you can't even see. It's amazing. And
they can't tell us that they've got a toothache like our kid can, or something along those lines. I mean, my own dog recently had to have this tooth and that tooth pulled out of his mouth because he had a tooth root abscess. And I'm a veterinarian, so I'm supposed to know these things, but there were no outward signs until all of a sudden one day he started shivering, and I brought him in, and that's why. So you can miss it. I mean, it's not just, you know, because you don't have the vet degree. I do have the vet degree, and I didn't even notice it until it was too late, so those teeth had to come out. So give us some other tips. We've got about a minute left. A few more tips on just the other things that you mentioned rather than just brushing.
Well, first, monitor your pets. If you notice any changes in behavior, pain, or they're dropping their food, then you really want to see your veterinarian. That's the most important thing. You know, and we look at every tooth as being a patient. So when you're unable to brush every single day, use some of these other things, such as there's rinses for the mouth, there's different types of toothpaste, there's chewies, different types of rawhides that they can munch on, and different types of food that will actually help keep the plaque formation from being on the tooth. It's pretty awesome tools out there. And the best place to go is to the VOHC, which is the Veterinary Oral Health Council. If you go to their website, they have a seal of approval on products that they recommend to reduce plaque and tartar formation on a pet's tooth.
Excellent. And you can find out more information at AAHA.org as well, and you can check out their Facebook page. We'll have the links on our Pet Show Facebook page. Thank you so much.
Thank you so much.
All right, everybody, stick around.